It is a great satisfaction to greet you again. I hope you and your pet are well. Today we will talk about the following. How to treat and prevent the deadly Parvo virus. Parvo is a highly contagious virus that causes an animal's small intestine to become inflamed. Dogs are most often infected with the virus before 6 months of age, although older dogs can also contract the disease. 1. How do dogs get Parvo? Dogs contract gastrointestinal disease through exposure to vomit, fecal matter, or surfaces in clothing that contain infectious organisms. The incubation period for infection is 4 to 14 days, and infected dogs can begin to transmit the virus before they show clinical signs. Canine parvovirus is ready to invade unprotected dogs wherever they gather, including dog parks, kennels, and even backyards where the virus can linger for a long time. Early vaccination is vital. 2. Symptoms and signs of Parvo. The virus targets a dog's digestive system, so that is where some signs of infection will be seen. Here are some signs to look out for. Vomiting. Diarrhea, often bloody and watery. Fever. Loss of appetite. Lethargy. General weakness. Vomiting and diarrhea is seen most frequently in puppies between 5 and 6 months of age who have not completed their vaccinations. Any dog or puppy showing these signs should seek help from their veterinarian as soon as possible. 3. Parvo treatment. Veterinarians perform diagnostic tests that identify DNA within a fecal sample and examine a blood sample to provide a parvovirus diagnosis. Immediate treatment should follow diagnosis. The parvovirus treatment process is very complicated. Treat shock with fluid therapy. Rehydrate with intravenous therapy. Affected dogs have lost large amounts of moisture through vomiting and diarrhea. Replace nutrition that was lost due to gastrointestinal problems. Take additional nutritional measures to restore metabolic maintenance. If your dog is infected, your veterinarian will review all the details of Parvo treatment. Some options even allow you to treat a dog at home rather than requiring several nights of hospitalization. Parvovirus treatment is improving. Still, it is expensive and hard for the dog to go through this, so vaccination is absolutely the best idea. 4. Keep your puppy safe from Parvo. The vaccine is key and it works, but what should you do before your puppy finishes his initial series of vaccines at 4 months? Be smart about it. If you know your puppy isn't done with vaccinations yet, don't go to dog parks or around dogs you don't know. If you want to expose him to a big box pet store, for example, just take him and don't take him. Put it on the ground or sniff it in the parking lot. Many of these pathogens are killed by direct sunlight, so choose areas exposed to the sun for it to learn and sniff. It is also recommended to discourage your puppy from drinking from puddles and eating incomplete things found on the ground. If you are unsure whether your dog has been protected against Parvo, schedule an appointment now for his preventative vaccinations. And while you're at it, make sure your dog is up to date with all of his reinforcements. 5. Can people get Parvo from dogs? According to the Centers for Disease Control and Prevention, humans cannot contract parvovirus from a dog or cat and vice versa. Parvovirus B19 infects humans, but this particular strain does not infect animals. Strains that can infect animals do not infect humans. Of course, it's always a good idea to use safety gear like gloves and disinfectant products when cleaning up any messes from an infected pet, and you should prevent the virus from spreading in a multi-pet household. It is a pleasure to inform you and help you. If you have not subscribed to the channel, you should do it now. Take care of yourself and your furry friend. A hug, and until the next video.